I didn't quite realize how big this market and problem is.
I don't think there's anybody that I've met who hasn't had a friend, a family member who's been impacted by alcoholism or addiction.
There's a lot of shame. There's a lot of misconceptions that are involved with it.
And we're in the middle of this crazy situation with COVID right now, and mental health needs to kind of be on the forefront.
The main thing I'm hearing is that people are afraid to enter into a treatment level of care or get help because they don't want to have to experience those withdrawal symptoms.
And they don't know that the help is available.
And there's at least 300-400 comments that I'll see a day from people that just talk about shame and why can't I control, why can't I do this in moderation, and they just don't know.
I just found it so eye-opening that it impacts 300 million people worldwide. It's a $42 billion industry globally.
300 million alcohol alone.
Kind of the opposite of addiction is connection.
We have a misunderstanding about addiction that because you don't have that with cancer, you don't have that with diabetes. People who have those illnesses you don't get in the way of their getting better.
But for every one person that struggles, there's probably 3 to 5 people that are close to them that also struggle with this.
300 million people, alcohol alone, right? We can't open up enough treatment centers, to deal with that.
Right? Everybody starts opening up. The therapists walk by and they're like, how did you get Jim up dancing and singing? He doesn't talk to anybody.
The challenges that we have is that people have stigmas of addiction, right? They think it's a lack of willpower. What am I doing wrong? When in fact it's a genetic bullet. And once they understand that it's a treatable medical disease, it completely changes the dynamic.
Kids struggle with anything from cutting to self-harm to, they might have a family member at home that's struggling, a mom or a dad, and then you put in the stress of school and everything else, and it's a recipe for a mental health crisis.
And modalities we use in treatment has grown and changed. As you can imagine, the early days of AA, you might see in a movie of just people in a church basement smoking cigarettes. Now we have very in-depth treatment centers doing all sorts of stuff.
What we've known in the research for more than 40 years is that people actually need 90 to 100 days of treatment if they have a significant addiction problem, with a full year of support to really have a good chance at recovery.